I really like to go to the gym, fish, golf a little bit, work in the garden, travel, and basically just enjoy myself. I was a ballroom dancing instructor for about 4 years, and I really enjoyed it. I've been pretty much healthy all my life, until recently, maybe the last 7 years.
Doctors discovered that Henry had significant blockage in his coronary arteries. Following surgery to clear and open the arteries, Henry began experiencing other symptoms.
Besides the heart trouble, my legs began to bother me. Cramping in my calves, toes tingling, no feeling. It stopped me from doing a lot of things I wanted to do, lots of things, especially like dancing and going to the gym.
Henry came to the University of Michigan Cardiovascular Center, where he was diagnosed with peripheral arterial disease, a common condition affecting about 20 million Americans.
Peripheral arterial disease is similar in many ways to coronary artery disease, where atherosclerotic plaque builds up in the arteries of the legs. This can be caused by a buildup of cholesterol, can be related to risk factors such as smoking, diabetes, hypertension, and having elevated cholesterol. And there are genetic factors that also probably play a role in development and progression of peripheral arterial disease. Atherosclerotic disease is a systemic condition, so if patients have the buildup of atherosclerosis in one group of arteries, they're at significant increased risk for developing that atherosclerotic disease in other arteries. Therefore, patients with coronary artery disease are at increased risk for developing peripheral arterial disease and vice versa.
To answer the needs of the increasing numbers of people affected by peripheral arterial disease, or PAD, the University of Michigan Cardiovascular Center has started one of the country's first multidisciplinary programs devoted to managing PAD.
We've brought together experts from multiple fields, all who are focused on the treatment and management of patients with severe peripheral arterial disease. These include experts from vascular surgery, vascular medicine, cardiology, interventional radiology, and allied healthcare professionals who are all working together to take care of our patients.
For some patients, eliminating risk factors for peripheral arterial disease can help reduce symptoms. For others, medications may be added. If those fail to improve symptoms, patients can undergo a minimally invasive revascularization procedure to clear the blockage and improve blood flow, reducing or eliminating symptoms.
Patients' quality of life prior to revascularization, when they have severe peripheral arterial disease, can be significantly impaired. And we've seen significant improvements in patients with severe peripheral arterial disease in their quality of life after such revascularization procedures.
I'm glad I had the procedure done. My life is so much better. My legs are better. I feel better. I can go do things that I couldn't do before. My legs feel like I'm a 40-year-old man. They don't feel like a 58-year-old man. And I can really kick them up a little bit. So, that's good.